Nice curly one coming out. Pull it out, pull it out, pull it out. Yo, there we go. Okay, so this can happen in really thick, more curly, coarse hair, as we see here. Woo! Oh my God. Look at the size of that baby. That's going to be one of the biggest ones I've ever seen. So extended long ingrown hairs like this have a term. It's called pseudofollicular Barbie, which is a chronic inflammatory condition caused by hair curling back into the skin and causing an inflammatory reaction. You can see some of the inflammation around the outside there, and all that's going to resolve now that that's out. He's got something between his fingers. He's pushing it out. Not sure what part of the body this is. Ooh, but that's a really long one there. There we go. So here's one, it's kind of old, it's chronic, it's got some sebum wax around it, and it's got some chronic inflammatory signs in that it's not bright red, it's darker there. Okay, so he's just slowly tweezing it out and trying to get that keratin plug with it. That looks like he got a little bit of inflammatory tissue around it right there he just pulled out, but the hair looks like it's still in there. He just, woo, yanked it out. Here's a smaller one. Ooh, boy. All right, that tweaked out pretty good. Here's another small one. Now, the primary cause is hair removal from waxing, shaving, tweezing, which leaves a sharp tip on the hair shaft that can more easily penetrate the skin as it grows. Ooh, that one had some inflammatory tissue around it, but it looks like he got it all. Okay, here's another guy there. Pulling it out, tweezing it out, pulling it out. Ooh, there we go. Now, the mechanism, instead of growing up and out of the follicle, the hair grows sideways and under the skin. This causes the surrounding skin to get red, inflamed, and sometimes pus-filled bumps or pustules. This one's got a lot of inflammation around it right there. Okay. Only got it partially out there. Still has a lot of inflammation and the hair's still in there. Ooh, and there we go. That one came out kind of easily. No yanking there. This one has some inflammation around it. It looks like some crusting, so it's been there a while. Now, some of the symptoms can be red, inflamed bumps or papules, pain, itching, or tenderness of the affected area, and sometimes even pus formation, indicating a possible infection. Oh, there we go. Hey. That has some chronic scabbing around it. Now, if these are left untreated or repeatedly irritated, can lead to further medical issues. Ooh, there we go. There's a smaller one, at least it looks like it's small. It got like 5 or 6 hairs in there together. Sometimes a follicle can have 5 or 6 hairs coming out of it. Oh, there we go. Oh, here's a crazy clump. Oh, look at that. It's got some chronic inflammation around it. The hair that's still there, it's caused all that. So some of these chronic ones with chronic inflammation can cause scarring and infection, which could cause permanent scarring, including raised, dark scar keloids in some cases, or fine depressed scars. That looks like a kind of a chronic one there, which is all dried up and scarred over with a keratin plug on it. Oh, there we go. Hey. Okay, now this one's straightforward. It's like, ooh, looks like a long one. Break off. You always got to get it at the base by the skin to prevent it from snapping off. Persistent little bugger. Whoa, there we go. Looks like he got all that because it had a little ball at the end of it there. Ooh, there's one in the eye. Ooh, that's a really sensitive area. If she sneezes, that instrument's going to go right in her eyeball. Wow. That's really delicate stuff there. This looks like a kind of a chronic one. It's been there for a while. Oh, there's a real curly one. Ooh, boy. All right, that tweaked out pretty good. There we go. Ooh, wow. That's like a huge keratin plug around that. That one's been there for a long time. That may cause a scar. But that has a little fresh inflammation there. That's kind of raw. That's a little bit of an infection there. Yeah, that's definitely infected. That should be on antibiotics. Oof. This looks more like a chronic one coming out. It's funny how these are like the iceberg that sunk the Titanic. They have a little opening and the thing's much bigger underneath the skin than on the outside. Nice. So you can use some medications to treat some of the symptoms. You can use topical steroids, prescription strength, that can reduce some of the inflammation. Antibiotics, topical or oral, to treat infection. You can also try using retinoid creams. You might want to try some hair slowing creams. A doctor may prescribe epifluorethine hydrochloride to slow hair, reducing the incidence of ingrown hair. So here's a hard keratin plug. Oh, there we go. Hey. Ooh, that's a crusty one there. Looks like it might be somewhat liquid to it. Oh, here we go. Here we go. Whoa, there we go. It's out. Yeah. Here's another one. Nice curly one coming out. Pull it out. Pull it out. Pull it out. Here we go. Yo, there we go. Okay, here we go. Here's another crusty one there. And that one has a lot of keratin around it. Ooh, see how it went sideways? That's what caused the problem. There's one. Ooh, it's going to be a big one. You can see it has a lot of curls on the top. That usually means it's going to be a lot deeper. Wow, it's pulling out like some hay there. Oof. There we go. Eek. Okay, this one's going. It looks like pretty straightforward. It's deep. It's kind of thick. Yeah, it looks like when it came out with that hook, he's got it all out. That's the part that curled in. So this one here, you can see has some darkness around it because it causes hyperpigmentation issue. That's one ugly, chronic, crusty one there. You can see how hairs like this are thicker and curlier. Those are the ones that are more prone to this happening. So this one kind of really don't see much except like a crusty scab on the outside there. Oof. That's kind of a chronic looking one right there. You want to scrape out all that crusty stuff. That has a little bit of a cyst to it with old keratin in there. Oof. Nice. So this one has a little bit of redness to it, irritation. This has a little bit of a chronic and acute process to it. This is interesting. Look how it came in and out of the skin. He's pulling it. It's coming in the skin, but it went out. All right, there it is. He's got a lot of little follicle ball at the end, meaning he's got it all. Here's one causing a little bit of a hole here, but he's grabbing the hair and it's pulling out. Yank it out. It looks like he got it. Okay, here he has ingrown hair sticking out with some keratin there. It looks like it's been there for a while. Oh, that was a pretty thick one there. You got to clean out all that crusty stuff, though. That's like old solid one there. Done, yeah. Ooh, nasty. Ooh, there we go. Keratin plug there. Okay, here's one sticking out. That's a ripe one, ready to go. Yeah, that was an easy one. Not too much inflammation around it. Okay, and there you go. Round 2 of React Ingrown Hairs. And if you like that, hit the subscribe button and like. And let us know in the comments if you'd like to see more of these videos on the way.